We went in to see his doctor at VA, Dr. Uribe.
And I had a hard time swallowing. And they did an x-ray, and he said that I had an obstruction in my throat.
That he had detected a small cancer in his esophagus, and that he thought it should be removed because it would only get worse.
He developed this pre-malignant lesion because he has a condition we call it Barret esophagus. Barret esophagus is a condition when your lining of the esophagus changed from the normal lining, which we call the squamous lining, to abnormal lining, which we call it intestinal metaplasia. Why it happen? It happens because patients like Mr. Yager have a lot of reflux, and too much irritation and reflux will develop these new layers.
Well, that's always something that you think is a death threat, because my father died of cancer. I have a sister that has cancer, so it's something that people fear.
Now, you know, at my age, I think, well, you have to die of something. You've never heard of anybody going out of this world alive. So I just accepted it.
In the past, maybe a few years ago, when we had very limited option for cancer of the esophagus, the only way to treat these pre-malignant lesions was to take off the esophagus completely. And you can imagine, after you take off the esophagus, it's a long tube coming from your mouth all the way to the stomach. Then after that, you have to pull the stomach up in the chest. And people with such surgery, they usually do not have long life expectancy after that. And based on the previous information that this is a pre-malignant condition, I suggested to them another approach of the treatment. It's a new approach, and this approach is called endoscopic mucosal resection. That is available here at University Medical Center, and I was trained at that procedure during my fellowship in Mayo Clinic, Advanced Endoscopy Fellowship, and I told him I feel comfortable doing this procedure.
All right, now you ready to go?
Okay. I'll see you in a little bit.
All right?
Well, you can carry me.
Don't get lost.
Yeah, you be a good boy. I really didn't believe it was going to be that simple, that they would just go in and take it out and it would be gone. And without any incisions at all. I mean, they just went down his throat, removed what they needed to remove, and then we came back a couple of weeks later for the information, and Dr. Othman said, well, it all looked good. He had taken everything out and it was gone.
It's like peeling off the lesion from inside the esophagus. So instead of removing whole the esophagus, you just focus in this tiny area, and you use this endoscopic method to remove the lesion from the deeper layer without creating a hole in the esophagus. He said, how come nobody ever gave me this option before? And then I told him, well, it is a new treatment. I explained it in details.
There was only two places that you could have it done. One was El Paso and one was San Antonio. So naturally, not having to go anywhere is much better than having to go to some other city, and then you have travel, you have recovery time, you have to stay somewhere, you have to go through all of that. So it would have been a very extensive thing.
And this way, when Dr. Othman did the procedure, it was only here about 3 hours, wasn't it? And we stopped and had breakfast on the way home. Now you beat that one.
You basically converted it from a huge surgery to a one-day procedure, or maybe half-day procedure too. And the result came back that this lesion is a high-grade dysplasia, which means it's a lesion that's almost a cancer, but not yet cancer. So actually we caught it in the right time. Luckily, the foundation at UMC helped us getting the machine to do Barret ablation, which means simply burning.
So this Barret part, now we are doing ablation.
This was a big step because we had many patients who are waiting for that. And before that, I used to send them to Mayo Clinic in Scottsdale. I used to send them to Dallas, Houston, and if they have relative in Albuquerque, I would send them there too, because simply there was no one in town doing it. By doing this in town, we saved our patient, the one who suffered from Barret esophagus, we saved them going so far away to have this procedure done.
It's very hard to see because it's tiny small.
also now establish a gastroenterology fellowship. In the first time in El Paso, this was a big event because right now we are training physicians to be gastroenterologists here in El Paso, who most likely is going to stay here. We know that in town we don't have enough gastroenterologists or doctor in general, and having training programs in one place makes a big difference.
Really, because there's so many people in El Paso that need these procedures, and they have to go out of town to have it done.
If you have the ability to help, that you should. It's a very worthwhile cause. El Paso is a very large city, and since we now have the medical center here, then if we can make it better, you should.
Also with the new unit that we're going to open, and this will be also a big game changer too. We'll be able to do more procedure. Right now in the unit we reach the maximum capacity. We do more than 4,500 procedures yearly. This is maybe more than 20% compared to 2 years ago. And 20% increase is a big increase, you know, if you look at it in such short period of time, and also without adding more physicians. So now with adding more physicians and more gastroenterology fellow and having a state-of-art endoscopy unit, we're thinking that the future will be more bright here. And that's why we're looking for the support and help from the community.